everybody. We've got everybody who could be here today. So welcome again. I think hopefully we'll have pretty much the full group now. My name, for anybody else who doesn't know me, is Hugh Salmon. I'm the director of the Global Social Service Workforce Alliance. I'm just renaming myself in the Zoom as well, so you can see that. I think I've met most of you or interacted by email. I'm based in London, and my colleague Alina Sherman is also on the call, and she's our communications and advocacy manager. So we are working jointly with Annie as our co-chair and in facilitating this task force, and we're also supported by Beth Bradford, who many of you will know, and is the consultant for this particular task force and for the process of developing thematic brief, which you'll hear more about that from us and from Beth shortly. So I'm just going to advance the slides just so I can just briefly go through the agenda for today. So we're just at the welcome and introductions at this stage. This is just in English this time round, but just so that you're aware, when we see, I know it's a bit of a chicken and egg in terms of language. Obviously, if we communicate more in Spanish or other languages, we'll get more participants, but we may have a separate interpreter or even a separate meeting for other languages in due course. But just for now, I'm afraid this one's just in English. And for those who can't make this meeting, the recording will be shared afterwards, as well as notes. So we're then going to hear a little bit more from Beth about the collaborative platform, how it works, anybody not familiar with it, a little bit about the UN General Assembly resolution on alternative care, and then the thematic task forces and how they work, and therefore how this fits within that bigger picture. If we could just mute, if you've just joined, it'd be helpful if you could mute. Alina, maybe you can help with that too. Okay, so then we'll move on to looking specifically at this task force. What are the goals and tasks of our task force? And we'll have an overview of the issues around social service workforce and children's care. And that will be a participatory kind of plenary discussion. We have a Jamboard, and it was posted in the chat. Maybe that link can be posted again so that everybody can be using that Jamboard. We really want to use it as a kind of group flip chart. So you can write your own post-it notes or sticky notes onto the Jamboard. We can also write those for you. So when we split into groups, which is the next part of the agenda, the small group exercise, which will take about 40 minutes, Annie, myself, and Beth are going to be in each of the groups, and we can take notes as well to put into those post-it notes if anybody's not able to do so or would rather just talk. But then it will act as like our collective flip chart, and we can see what the sort of the collective of the discussion so far, and it will be available as a record of the meeting as well. And then we'll have sort of next steps and wrapping up. So that's the main overview of the agenda so far. By all means, use the chat. This is a meeting, not a webinar. So use the chat for any questions, or raise a hand if you wanted to speak. And we would certainly, when it comes to the discussion, we're going to invite people to speak as well as use the Jamboard. The small group exercise will be kind of like a World Cafe type thing. Is that right, Beth? Where people sort of move so everybody gets a chance to address of the three major topics. You'll move in your group and address one topic after the other, but Beth will explain how that happens when we come to it. Okay, so I think over to you, Annie, if that's okay, to sort of introduce yourself and then to get the group to introduce themselves. And I think, Annie, you were going to say some opening remarks as well from your point of view. So as my co-chair, handing over to you. Thank you.
Sure. Thank you, you. And first and foremost, thank you everyone for joining. I know I can see in the list people have joined all the way from Cambodia to Copenhagen. That we have like a vast gamut of people from all over the world, and at some very odd times also. So apologies for that, but thank you for considering joining us today. Good afternoon, good evening, good morning to everyone. My name is Anirudh Kulkarni. You can call me Ani, much easier. I work in UNICEF in New York in the Child Protection Systems team, and I'm very pleased to be co-chairing this particular task force with the Global Social Service Workforce Alliance and with you in particular. I will not get into too many details as to why we are here today, but just wanted to mention that we are going to be having some really interesting and exciting conversations. And the fact that so many of you have shown interest in this theme of the role of social service workforce in the care reform agenda, it's something that is of really great significance to all of us. And we are hoping that we can collectively and have very frank conversations on this group in this platform and come towards developing a thematic brief, of which we will of course hear more details about in the subsequent slides. But before we jump into too many details of what it is all about, I think given that it's a first meeting and given that we are hoping that we as a group will continue to work together over the next few months to develop a, a thematic brief on the role of social service workforce in the care reform agenda, we wanted to take some time in doing some introductions. We would really like to know your name, of course, and where you're from, which organization you work with, and especially your interest in this particular thematic conversation that we are having, which is the role of the social service workforce in care reform. So what I'm going to do is that I can see the names list of participants here. I'm going to call the names if you don't mind, and if you could briefly introduce yourselves and express why you're interested in joining us in this particular group, and give us a little bit of a flavor of your work as well. So without further ado, can we start with Ginny?
Sure. Can you hear me?
Yes, of course.
Okay. It's nice to see you, everyone. Well, how to describe? So I am a former practicing child welfare social worker here in the United States. Then I taught social work at a university for 25 years. Now I am a professor emeritus and independent consultant. So that's my experience, and mostly in child protection and workforce strengthening.
Thank you, Ginny. Welcome to the group. Warren? Warren Thompson?
Yes, are you hearing me?
Yes.
Okay, great. All right. Hi, everyone. I'm Warren Thompson. I am the Director of Children and Family Programs at Jamaica's Child Protection and Family Services Agency. And here we do everything child protection, including providing support for or over 4,000 children, almost 5,000 children who are in care, either in foster care or in residential childcare facilities. I'm particularly interested in the care reform work because we have embarked on care reform here in Jamaica. We are actually starting our Maintaining Children in Families initiative. In fact, we have a consultant who should be starting this week, who should be coordinating some pilot initiatives that we will be implementing as we look towards getting children out of institutions and into family-based placements. We have a target that by 2030, we will have less than 15% of children in care in institutional settings. And I could say much more, but I'm here to learn and, of course, to contribute where I can.
Thank you, Warren. And in fact, we are also here to learn from you and a lot of great work that is happening already in Jamaica. So look forward to your very active participation. Could we invite Soumi Chakrabarti to introduce yourself next? Soumi?
Hello.
Hello.
I am Soumi. I'm working with CINI, Child in Need Institute in Jharkhand, India. It's in the eastern part of India. It's a state dominated almost by 60% population is indigenous population. our child protection system in India is governed and managed by the Juvenile Justice Act 2015 and the recently launched Mission Vatsalya Scheme 2020. Although the acts and the policies do direct towards family-based care and family as the best place for children, the practice here is dependency on institutional cares, that is the child care institute as we come to know them in India. So we are working in this district with the state government to have a shift on this perspective from institutional care to family-based care, alternative cares, and treating the child care institutes as only short-term institute and transit institutes. So basically, CINI has a child-friendly community model, which is both top-down approach and bottoms-up approach, which targets the community at the center, the child at the core, and the community, families, social institutes at the periphery, and reaching up to the government and the duty bearers. So we are trying to strengthen the community, develop community-based models, so that the safeguarding at the community protects the children from any type of vulnerability, which leads and pushes children to community institutes, and also pushing on the government and the duty bearers to take up steps to send the children back to families who are there in the CCIs without any necessity. Although the challenge we
Somi,
face a lot is...
Somi, sorry if I could disturb you for a moment. If you could just very quickly explain your interest in this group so that we can move to the next participant. Thank you.
Sure. Thank you. So as a practitioner on family-based care and care reform, I would like to contribute my learnings as we work a lot with the community and family strengthening approach, and also learn more on the family strengthening approach, because that's one of the challenging part for our side. Thank you.
Thank you, Somi. Thank you so much. And we look forward to your participation. Blessing, could we go to you next?
Thanks. Hi, everyone. So yeah, my name is Blessing Mutama, and I'm a director with an organization called FOST. We are based in Zimbabwe, and we are a member of Family for Every Child, a global alliance for national organizations that are dotted around the whole world. So yeah, maybe just to give a background, for us, social services plays a critical role in child protection and care reform work. And as Zimbabwe, we've had challenges here with the ratio of social workers against the children who are needing support from these social workers, where we have ratios such as 1 to over 4,000. You know, one social worker to over 4,000 children per district. And we've experienced a lot of brain drain with social workers relocating to Europe. And as a country, recently we have developed a new policy on alternative care for children, and we are looking at how probably we can improve our social services workforce, maybe by looking at how volunteers in the community can actually complement, you know, the role that was being played by social workers who are employed by the government. Yeah. So I'm looking forward to be sharing our experiences here in Zimbabwe in terms of social services workforces, and looking at how we can move forward, yeah, in improving our situation. Yeah.
Thank you. Thank you so much, Blessing. Carolyn Hamilton, nice to see you here. If you could introduce yourself.
Sorry. Thank you, Annie. Nice to see everybody, and thank you for inviting me. I'm Carolyn Hamilton. I am a lawyer, but I have always worked with children. I'm a professor emeritus of child law, and I now run Quorum International. And I was a qualified barrister, and I took a lot of childcare cases. That was my mainstay of practice. I worked with Annie on the child protection system strengthening, approach and the benchmarks and other consultancies. So currently we are looking at childcare reform in the ICARO region. We're evaluating those childcare reforms, which include, of course, social workers, how that's developed, how alternative care has developed, legislation, governance, the range in 7 countries in ICARO. And we'll also do a regional report. And we're also doing a social services workforce mapping in Jordan and in Bangladesh, which is almost finished, and a mapping and assessment in the Philippines, looking very much at all the benchmarks of the child protection system strengthening. On top of that, we do a lot of legal reform. So we do draft laws with governments, putting in place a social work system and an alternative care system. So I'm very interested in the practice element as well as the elements that we deal with, which are sort of research, legal reform, evaluation of systems.
Thank you. Thank you so much, Carolyn. And no, in fact, it will be really interesting to have you join us and have these conversations together, because we are really hoping that through this brief and this conversation, we will be able to connect practice and policy very well together based on evidence. So thanks for participating. Next, we are going to...
Annie, I might just offer my apologies because I do have to go at 3 o'clock. I'm sorry. Next time we'll be fine.
No worries. Thank you. Thanks for letting us know. Carolyn Hausman.
Hi there. Sorry about
Hi.
that. Good to see everyone. I'm Carolyn Hausman. I am Vice Chair of the Global Social Service Workforce Alliance, but I think I'm really here in my capacity as CEO of Children and Families Across Borders, which is a charity which protects children and reunites them with families in the UK and in 130 countries, chiefly through the International Social Service Network, but also through independent networks and as a member of Family for Every Child. I think it's probably also relevant to mention that we host the Secretariat for the Commonwealth Children's Interest Group as well, and currently are working on reporting back on progress against the Kigali Declaration in advance of the Commonwealth Heads of Government meeting in 2024, which I know some people on this call are also working on as well. So have a sort of very varied and wide interest in care reform in the UK, but also around the world. Thank you.
Thank you, Carolyn. Could we go to Chipo next? Chipo?
Oh, sure. Sorry.
No.
Hi, I'm Chipo. I'm a social worker. I was quite interested listening to Caroline Hamilton because she was talking about being a lawyer, and I'm a qualified social worker in Zimbabwe and in the UK, and I have practiced for about 19 years now as a manager in fostering and adoption services, child protection in the UK and in Africa. And I took a career break to retrain in law. And I've just finished my master's in international children's rights at Leiden University. And I'm currently doing an internship with the International Social Services in Geneva. And I wanted to be part of this group because all my work is really about practice teaching and quality assurance and social service workforce development. So I thought maybe I could have something that I could bring to the group, but also, you know, with a combination of social work practice and maybe a little bit of a legal background. So I hope I'll be able to learn from you and maybe also hopefully contribute something. Thank you.
Thank you so much, Chipo. No, we are really looking forward to your active participation and learning from you as well. Could we go to Catherine next? Catherine Lafleur.
There. Yeah, thanks for the invite. Catherine, I work with an organization called Bethany Global. I'm based in Grand Rapids in Michigan in the US, but we're an international INGO. I'm a social worker, a decent amount of background in direct services, and my role in the organization as programs director is to support our programs across the continuum of care in Ethiopia, Ghana, Haiti, and Colombia. So I've been involved in care reform work, transitioning of orphanages or residential homes, and the development of local foster care and adoption systems. Yeah, so excited to learn from you all and hopefully contribute from that direct service implementation lens.
Thank you so much. Thanks a lot, Catherine. Next, we have a colleague from Changing Heights. If you could introduce yourself. Thank you.
Afternoon from Ghana. I'm Jonathan Kojo Anderson. I work with Challenging Heights, a child rights organization in Ghana. And I had this invitation from Hugh someone whom I've known in Family for Every Child. And I want to see what I can learn from this meeting to support work that we do in terms of protecting the rights of vulnerable children. Thank you.
Thank you so much. No, we are really very excited. We have so many different participants from across different regions. Can we go to the Eastern Africa now? Crispus from Changing the Way We Care in Kenya.
Hello. I hope you can hear me.
Very well. Thank you.
Thank you so much for the invitation. I am Crispus Natala. I work for Changing the Way We Care in Kenya. It is an initiative that we have for over 4 years been implementing around care reform. And I work for Catholic Relief Services. So it is my pleasure to be in this group. And in the work that I do, I am the case management for integration and prevention advisor in Kenya. And my work simply revolves around working with the workforce. And for me, I take pleasure in being part of this group to share what I have learned working with the workforce, and also to get to learn from the other regions and see how best to improve my engagement with the workforce as we try to either reintegrate children back to their families or even prevent them from separating with their families. So I know I will gain some rich experience from across board. Thanks again for the invitation.
Thank you, Crispus. Could we go to Eddie next? Eddie Valakira.
Thank you so much, Annie. Eddie Walakira. I work here at Makerere University. I'm so excited to be online. I'm also happy to meet Beth again. I work as an associate professor here at Makerere University. I'm a child protection specialist, so to say. I have extensive experience of working with the civil society organizations and governments in developing packages of training programs that have covered, that have been used within Uganda and also regionally. So I bring a regional dimension to this field. For example, I've worked on child protection training programs, which we have delivered countrywide, worked with many international organizations. Case management training packages and programs. Also, I do a lot of research on these themes to do with child protection, reintegration of children, alternative care, etc. So I hope I'll make a contribution, but also learn a lot about what is going on. So I'm happy to be online.
Thank you so much, Eddie. Thanks a lot. Esther, could we go to you next? Esther from UNICEF in the Western Central Africa region.
Thanks a lot, Annie. Good afternoon, good morning, everybody. My name is Esther. I work in the Western Central Africa regional office for UNICEF. I used to be in the regional office in Latin America and the Caribbean. I was in charge of the alternative care agenda when I was there. Here, I'm in charge of the social service workforce agenda and the violence agenda. And there will be another colleague that will join for the meetings, Cecily, that is working also on the alternative care. So for us, this is a priority, the work on social service workforce for all West and Central Africa countries. We covered 25 countries, 24 country offices we have. And this is a priority for us in the region to strengthen the social service workforce and also to strengthened also for emergencies given the situation in the region, taking into account how many children also became alone because of emergencies and how the alternative care system should provide services for them. Thanks a lot, and it's a pleasure to be here with all of you.
Thank you, Esther. Thanks a lot. And now my list has become a little bit more jumbled, but I'm going to try and see who I have not gone to yet. I think on my list next is Joe. Joe, could we have you introduce yourself, please? Thank you. Joe Rogers.
Thanks, Annie. Good to see everyone. Lots of familiar faces, which is always nice. My name's Joe Rogers, and I work with Partnership for Every Child, which is also a member of Family for Every Child. And I also work as a consultant with the Asian Development Bank, with UNICEF, different regional offices, and also country offices. And have been doing quite a lot of work around care reform in many different contexts over many, many years, more than I care to mention. And recently have done an analysis of care data from the Europe and Central Asia Regional Office using TransMoney data, which will come out soon, which is quite interesting in terms of, sort of care reforms and being able to try and actually track them. And I'm interested in this group, well, partly because Hugh invited me, and I'm always happy to help Hugh, and because Annie is involved, and we were involved in with Annie and Hugh in looking at the social service workforce in the Europe and Central Asia region a few years ago. Since then, I've also been involved in the East Asia and Pacific region, looking at the social service workforce. I think that social service workforce absolutely critical and key to any reforms, childcare reforms, and really important to get it right. I think, I think countries really struggle sometimes with getting the right balance of different workers in the right positions with the right functions, the right competencies, and I increasingly think it's important. Have also done some work around costing, and looking at the social service workforce in terms of ratios, costing, and some of the public finance aspects. So I'm really looking forward to learning from everyone. Really interesting mix of experience and global experience, and also happy to share and help as as necessary.
Thank you so much, Joe, and we look forward to learning from you as well. Yeah, I've been told that we need to pick up pace on this, but we want to definitely spend enough time introducing everyone. Can we have the real Kiran introduce herself? Kiran's AI assistant has introduced themselves several times by now. Kiran?
Yeah, hi Annie. I'm so sorry. First of all, can somebody throw out this auto? We tried AI and now it is stuck to me and I've not been able to remove. So if whoever is managing this this call, if they can just throw this auto out, I'll be so grateful. Well, I'm Kiran Modi. I'm from India. I founded this organization called Udayan Care. And it's a 30 years old organization, and we've been very much interested in children without parental care and how do you strengthen families. So that had been our mainstay from the beginning. Besides running group homes, which are changing its character very fast, in keeping with the global need for children going back to families. We've been restoring children back to families, with proper care, as well as shifting the focus of the homes on as emergency care homes for children who don't have any care. We are also working in communities to strengthen families so that their children don't get separated. It's a wonderful program, and I can see our partners, Louise and others who are here, then, we've been very much interested in care reform, and we've been organizing these BICON, international conferences, and I'm so glad that many of my BICON partners are also here. And we've been conducting a lot of functionaries trainings in different parts of India, in different states of India. For example, Bihar and Madhya Pradesh, Telangana, where we are dealing with child protection functionaries and trying to develop master trainers on family-based care, alternative care, FBAC. So it's an area of great interest for us to learn from this group as well as share whatever little we can share. So I'm very much interested in this group. Thank you.
Thank you so much, Kiran. And on that note, could we go to Lena next? Lena?
Hey, hi. Thanks, Anirudh. Thank you for taking me after Kiran ma'am. So my name is Lena Prasad and I work with Udyan Care. I'm based out of Delhi. And in addition to what Dr. Modi's already spoken about the organization, I also wanted to say that when we started the community-based family strengthening program 2 years back, we were looking for community mobilizers. And I must say that, it was my luck that I came across 2 young care experienced persons who I could, engage as community mobilizers in my reintegration project. And I must tell you that, over the last 2 years, we've seen that when you're engaging care leavers, young people with real experience of being in care, and then they are working with families in communities to ensure that children don't get separated, children stay away from institutions. The results are magical. Over the last couple of years, we've also been able to engage care experienced young people across our different programs where we are providing direct support, aftercare support to care leavers across different parts of the country. And it's really been a learning experience to understand how care leavers can be, turned into professional social workers. There are challenges, but I think the outcomes are beautiful. And plus also, I think we have another program that we are piloting in Delhi, where we support care leavers, young people who just left care institutions on turning 18. And we're trying to provide them direct skilling and employability career pathways. We are encouraging a whole group of 30 care
Lena,
leavers.
if you don't mind, if you could
just
wrap it up
20 seconds.
so
Yes,
that we
20
can.
seconds and Yeah. So, this special cohort has been put in place where they are being coached to become professionals in the social sector. So that's a pilot project that we are trying to experiment. And it's, I think, going to be a big learning for us. Thank you, Ani.
No, thank you. And we really look forward to hearing more details in the subsequent sessions as well. Could we go to Leon next? Leon, our colleague from UNICEF.
Sure. Thank you, Annie. I'm Leon Muoni. I'm with UNICEF Rwanda Country Office, and I lead the child protection program here. So Rwanda is in a continuum of developing its child protection and social service workforce in general. From 2012, when the strategy for childcare reform began, and that has seen some progressive developments in workforce. And I think joining this platform would really help in terms of sharing experience, learning from others, and hearing, how others have also navigated this this terrain, but also share the peculiar and interesting journey that Rwanda has traveled, developing a child protection workforce purely from a pure focus on childcare reform, but now expanding focus into all areas of child protection, and also now bringing in other workforces that support on social protection and other social services, and sort of developing this and also incorporating elements around the ratios, mapping, and also doing a lot of public finance work to support incorporation of workforce within government plans. Thank you.
Thank you so much, Leon. No, indeed, we have a lot to learn from the Rwanda experience, including the work on children with disabilities, I must say. So really look forward to your very active participation. Could we go to Lopa next? Lopa?
Thank you, Aniruddha. Hi, everybody. Very glad to see a lot of known faces as well as new faces. I'm Lopa Bhattacharjee. I'm the Director of Alliance Program at Family for Every Child. We're a global alliance of local civil society organization, and our alliance is a member-led. The reason we are interested in this group is we've recently been working on an interagency kinship care guidance, which I'm sure many of you are aware of, and I also can see many of you who've been part of the development of this guidance and have also already endorsed the guidance are in this room. Through this guidance, we are looking at strengthening the practice of kinship care guidance at the practice and policy level, and to make that successful, working with the social workforce is so important, an inherent part of this objective. And that is why we are here, and we look forward to collaborating and learning from all of you here. Thank you.
Thank you so much, Lopa. Thanks a lot. Could we go to Louise next? Louise?
Thank you. Hello, I'm Louise. My background is social work, practicing in the UK. I currently work for the Martin James Foundation, and we partner with different organisations and social care teams in several countries. So really, thank you for the invite to be here, and looking forward to taking part and learning from the group.
Thank you so much, Louise. Could we go to Mariam next? Mariam?
Yes, hello, everyone.
Hello.
I'm happy to be here. I'm Mariam Al-Qasim from UNICEF Jordan Country Office. I see also some familiar faces here. We in Jordan support the government of Jordan in overall system strengthening of child protection, but also on the strengthening the social service workforce and the alternative care and the reforms related to DI. So I'm happy to be here. I see an abundance of experiences, and I'm basically interested in learning pragmatic approaches towards strengthening our work with the government, and maybe share some experience and lessons learned as well. Thank you.
Thank you so much, Mariam. And in fact, we are also keen on learning from the Jordan work, especially in the various humanitarian and refugee settings as well. So thank you so much. Otto, could we go to you next?
Sure. Hi, everyone. I'm Otto Shestak. I'm from Hope and Homes for Children. But working and having worked in the past 2 decades across the world, very interested in the topic. I have seen firsthand what a system, well, several systems, without the social workforce can do to children, and it's not nice.
Thank you, Otto. Thanks a lot for joining us. Becky, Rebecca Davis, could we go to you next?
Yes, hi. Rebecca Davis, and I'm located at Rutgers, the State University in New Jersey, USA, in social work. I'm a professor there. I've been involved with many of you from the early days in the 90s of trying to build community-based services, and then shifting the discussion more to workforce strengthening. And more recently, I would say I am involved with the UN NGO Committee on Working Group on Girls. So I've been doing some work around curriculum development and workforce strengthening for working specifically with girls who are at great risk. So that's me.
Thank you, Becky. Thanks a lot. And we look forward to learning from your experience as well. Sandhya, could we have you go next? Thank you.
Hello, hi everyone. So I'm Sandhya Mishra from Miracle Foundation India, and Miracle Foundation India is working basically with this vision of family for every child, with 2 basic objectives of prevention, like to support family and children, those who are at risk, so that children should not be separated from their family. And the second piece is about transition, which is a safer permanent transition from the childcare institution to family. We have some wonderful case stories of 100% transformation. Miracle Foundation India is working with the state and the government, basically on system strengthening in a big way. And I'm here to, of course, learn with this esteemed group, and super passionate about, strengthening the social workforce, take care of people who care for children. And also would like to understand and map out the social workforce, not only restricted to the child protection system, but also the community, all kind of different arena, right from the government to community, and also want to understand what could be the reward and recognition for this workforce. We know that challenges and gaps, what we have, understaffed or the whatever the situation we have. I think in India, of course, I can say that. So that's why I'm here, just to learn and also contribute to strengthening the fortified social service workforce. Thank you.
Thank you, Sandhya. Thank you so much. Suzanne, could we go to you next?
Hi, everybody. It's nice to be here with you all. I am from the Children in Distress Network, or Cindy Network, in South Africa, also a member of the Family for Every Child Global Alliance. We do research and advocacy to influence policy and practice, so do quite a lot of system strengthening and training for the social services workforce. And we're particularly interested in learning around how to strengthen the full system, so how we can include other role players and other people working within that system, as well as social workers, and particularly interested in foster care and kinship care and reintegration. Thanks for having me.
Thank you. Thank you so much. Next on my list is Seema Naz. If you could quickly introduce yourself.
Hi, I am Seema. I am currently associated with the Martin James Foundation. I'm a practice development coordinator and an academician in India. Thank you.
Thank you, Seema. Next is Tessa.
Hi all, I'm Tessa. I'm the Regional Director Asia for Hope and Homes for Children. Otto already sort of gave our view on why we would like to participate in this group. Also so nice to see very many familiar faces from the past, who I actually, with some of them, have worked on setting up social workforce systems, for example. My dear friend Ginny Robbie, who's on this call as well. So very nice to be part of this. Thank you for having us.
Thank you, Tessa. Thanks a lot. Suman, all the way from Cambodia. Sorry for making you wait till the
That's okay. That's okay. Thank you, Annie. So this is Suman. I'm child protection specialist. Actually, I'm in process of moving from Cambodia to Timor-Leste, actually. But I'll be sharing my experience in Cambodia. We've worked very closely with the government here on both very big, significant care reform agenda here, where there's been a massive reform and children have been reintegrated, and also a lot of work on social work for strengthening as well. So I hope to contribute and learn from you all. Thank you.
Thank you so much, Suman. Thanks a lot. And I think I hope I have not missed anyone, but before we go to the next one, I want to take the last moment to give the floor to Beth, who has this monumental task of coordinating all this fantastic experience over the next several months and help us get to a point where we have a solid thematic brief. So Beth, if you could introduce yourself very quickly. I know many people already know you, but Beth.
Thank you, Ani. It's really exciting to see so many people, this level of interest, but also just the diversity of roles that you all play and organizations that you represent. So I think this is going to be an amazing group, and I'm really glad that we took the time to do such introductions. I know it takes time, but it's critically important as we come together as a working group. So as Ani said, I'm Beth Bradford. I'm just coming off of having directed the Changing the Way We Care global initiative. from the technical side and am working as a consultant. So I'm really happy to be supporting this thematic brief on social service workforce. Did you want to say anything else, Annie, or shall I jump right into our next?
No, please go ahead. The floor is yours.
Okay.
Thank you.
Okay, great. Hugh, if we could have the slides back up in the slide 4, I think it is, that we would be starting on. If we have missed anyone, please use the chat to introduce yourselves. Again, as we continue to work together over the next months, it will be really great to understand who we are and be able to connect quite directly. So I'm going to be quick and brief because we did want to have that time for introductions, but just want to give a little bit of the reasons why we've brought this group together and what we hope to come out of it. And please do use the chat if you have questions. We can come to those at the end. And I'm going to be brief also because I'm making an assumption that that you're all very familiar with this already, with the UNGA resolution and some of the work that led up to it, as well as the collaborative platform. But again, questions in the chat are most welcome, and we'll come back to them and to anyone who needs a little bit more depth of information. 2019 December, the UN General Assembly adopted by consensus the first ever resolution on the rights of the child. As you'll recall, it focused on children without parental care, and it was unanimously adopted by the 193 member states. And it's really calling on the international commitments to children under the Convention of the Rights of the Child, the Convention on the Rights of Persons with Disabilities, and international guidelines. I think there's a feeling amongst this group and many other organizations that this is really an important step and a fantastic tool for our advocacy. Recognizing that opportunity of having such a resolution, there was a group, and again, all of us, many of us were part of it, 255 organizations and networks and agencies that came together to produce a really comprehensive set of recommendations that we all agreed to inform the resolution. So knowing that 2019 opportunity was before us, again, produced a set of recommendations that were then reflected in the resolution. These really focused on things that you might expect on reducing institutional care and placement of children in institutional care, of making sure that governments were, reaching their targets in terms of care reform, making the commitment to strengthening families, reducing some of the drivers like orphanage volunteering, et cetera, et cetera. And, as a result, there are many of the things in the key recommendations that were subsequently included in the resolution. In terms of the workforce, which is what we're here to talk about today, just a few things to point out from the resolution. It does call for adequate and systematic training for professional groups working with and for children. It calls for coordination amongst the different government bodies involved in promoting and protecting child rights. It calls for multidisciplinary collaboration across sectors. And it, of course, as you might expect, calls for decisions, initiatives, approaches to really be looked at on a case-by-case basis, best interest of children, and be led by suitably qualified professionals. So that's just a little bit of a background. We could go to the next slide, Hugh. That group of organizations coming together and the General Assembly then led to the development of this collaborative platform, the Transforming Children's Care Collaborative. And I think we're really pleased to see that the starting of this particular task group has actually brought a number of new people to the platform itself. The collaborative platform is meant to be a space to build on each other's work, to share experiences, to agree on some on some common principles and approaches, to secure greater impact by working together, by advocating together, to contribute to a common learning agenda, and to undertake joint advocacy. If you're new to the platform, there are many working groups, communities of practice, as well as these task forces. One of the task forces on advocacy felt like a next step related to the UNGA resolution was to develop some co-developed thematic briefs on different areas important to children's care, to really develop a global toolkit that will help governments and different decision makers to implement the resolution. So that's what the thematic briefs are about, and it's what these task forces are about. But as I say, the collaborative itself has many different opportunities for you to engage with. On to the next slide, please, Hugh. There are many different task forces. I'm not going to read them all out. You can see them on the screen. They are open for anyone to join. What we're pulling together from today forward is a task force specifically around the social service workforce in care reform. So that's what you're all here for. And the task forces are, the main task is to actually develop a very short thematic brief. Of course, through that to share experiences, to get to know each other, to perhaps identify other things that we could work on together. But the main task is a thematic brief, which becomes part of this advocacy toolkit and is really intended to support governments to implement their international commitments around children's care. There is only one thematic brief that has been finalized and published so far. It's the one you see in green, the orphanage, volunteerism, and trafficking thematic brief. We can share that at some point so you can have a look. It's short. It's focused on policy recommendations. I think it's 4 or 5 pages. I know a number of the other thematic briefs are on their way also to being finalized. So our group has quite a bit that we can learn from those that have gone before us. Go ahead to the next slide, Hugh. I know I'm going fairly quickly, so again, feel free to post your questions. Coming to this specific task force, the task force on social service workforce and care reform, the goal is to exchange learning on social service workforce development with a view to documenting some country level examples, deciding what we want to talk about in our thematic brief, what kinds of policy recommendations we want to make, and then using all of our diverse experience, really trying to document some examples that can help to show what those policy recommendations look like in practice and on the ground. It's quite possible, and hopefully this group will turn into an ongoing working group, perhaps identifying some other things to do together, or a community of practice just for ongoing exchange of ideas and information and learning. Next slide. So very, very briefly, sorry, Hugh, can we go to the next slide? Just to give a view of the
I'm showing
timeline.
The tasks. Is that the one you want?
Sorry, it is. Yeah, sorry, that's correct.
Yeah.
So forming the group, having an introductory meeting. That's what we're doing today. There will be an outline circulated to all of you to review a draft of the thematic brief and what we think it will look like. So Alina and I are really listening for topics and themes that you bring out today so that we can draft that outline and share it. We would expect that there would be maybe 5 more meetings after this. We are going to be welcoming a smaller subgroup to really help write and draft sections of this thematic brief. We would hope that the whole group would lend a hand in reviewing and also sharing and capturing case studies and examples. So this is I think Ani said at the beginning, this is a participatory group. It is a task group and has a task, and we're really going to welcome participation in any way that works for you. But all of the experience that you bring is really important. So maybe I can just pause for a few minutes and see if there are any comments, questions, points that need clarification around why we're here and what our task is.
Can we, before you do that, can I just welcome Janestic Tukarizi, who's just joined from Uganda. Janestic had a difficulty with the link that was probably caused by me, and I'm very sorry for any folks who were wanting to join that had difficulty joining, that maybe didn't get the link in time, but we'll hopefully get that sorted out next time. And if anybody
for sure
is still having difficulties joining on the platform so that you're a registered member of this task force, then please message me, Beth, or Alina, and we can try and get that sorted out. But yes, so Janestic is from Makerere University, as is in Uganda, as Eddie. So maybe Janestic, you can introduce yourself in the chat. And yeah, any questions or comments at this point before we go to a bit of a discussion?
I'm not seeing any, Hugh. We will share these slides and also the recording after, and feel free to come to us if there are questions. And now I'm going to turn over to Hugh, where we dig in a little bit on the topic and hopefully hear from all of you and begin to document some inputs. Over to you, Hugh.
Thanks very much, and I'll keep this slide up just for now. But those of you who've got the Jamboard link, you can start writing in your comments into the first page of the Jamboard. Maybe Alina could put that back in the chat again. The Jamboard link. We're going to, as I said, we're going to use the Jamboard as a sort of collective flip chart. And really, the first page is just for you to sketch out your thoughts on, what are the connections between social service workforce strengthening and care reform. I think we've already established through all your comments and Beth's great introduction that the social service workforce strengthening is of fundamental importance for achieving family-based children's care and achieving a transformation of a system away from reliance on institutions to family-based care, kinship care, foster care where it's necessary. And also prevention and reintegration, many of which you've all mentioned as your priorities. Just to say very briefly about some background to this for the Global Social Service Workforce Alliance. Before I joined this alliance in 2020, as you've probably worked out, I used to work before that for Family for Every Child. Hence, I'm seeing many people that I'm great to see again from that group, and many of you I know from other occasions, so it's just wonderful to have you all together. But since 2020, I've been in this alliance, and then before I even joined, we had developed a paper with Beth, and you'll see Beth's name on that paper on our website. So if you know our resources, you'll see that 7-8 years ago, we developed an initial brief, an initial thematic paper on the role of the workforce, looking at 3 specific countries. I think it was Moldova, Rwanda, and Indonesia, if I'm not mistaken. So we feel that was a good start, but I think things have moved on since then. We're really looking in this thematic brief to update that information, but also I think to bring in something that some of you mentioned about around lived experience, and we know more about what we can learn from young people who have experience of the care system and of their family members. So I think it would be good to mention also that the Global Social Service Workforce Alliance is embarking on another project in parallel to this one, supported by the Martin James Foundation, who are also represented here today by two colleagues, as you may have heard. And so together with Martin James Foundation and Child Frontiers, we are trying to bring together groups of young people and family members in Uganda, India, and in Brazil to look at their experiences of social services in helping achieve family care through prevention, through support for reintegration, and also for family-based alternative care. And the difference between a good and a bad social worker, what it's like having a social worker, not having a social worker, how social service workers could do more to help keep children with families or to support families through difficult times. So that is very much that sort of bottom-up perspective that has been lacking for so long, when we've looked at policies, we've looked at laws, training, curricula. And as I found in my time, one of the countries I know best is Kyrgyzstan in Central Asia, having lived there for a number of years. I moved there from having worked in Moldova, which is when I first knew Joe Rogers, and into Georgia. And those countries, the childcare system reform was progressing really well. And since then, so 23 years ago, in that time, it's now progressed incredibly well. Kyrgyzstan, I came to talk about foster care at a workshop in 2003. 20 years later, there was another workshop about foster care in Kyrgyzstan, and it sounded like we were saying the same things all over again. Nothing much had really changed in 20 years. And I scratched my head and I was thinking, how is it that some countries get stuck? Not that foster care is necessary, it's obviously not the whole solution. It's only one part of the jigsaw. But on that one particular thing, they were getting stuck. But they were also getting stuck on prevention and reintegration, because the numbers in institutions in Kyrgyzstan, as in others in Central Asia, had not reduced as they have been reducing significantly in countries like Moldova, Georgia, Rwanda, and others that you know well. So one of the things that I reflected on is maybe there's some resistance within the workforce, both the directors of institutions, which is a form of resistance that we probably all know very well, but even the workforce themselves, they just really don't know how to, they don't feel empowered or confident to work with families in a preventive way, or to enable reintegration, or to consider family-based alternatives rather than placing a child in an institution. And so they still revert to the default that they're used to of placing a child with institutions. As Joe Rogers has also mentioned in the chat, that maybe that they particularly revert to that for children with disabilities, because they don't understand that if you support the family sufficiently, or if necessary, a foster family or in respite care, you could provide care for a child with disabilities as well in a family context. So there are a number of challenges in care system transformation that I've recently been summarizing as linking heads with hearts with hands. So a lot has gone into the head, a lot of policy, law, curricula, education, training has gone into the heads of the social workers. They know they should be doing this, they've been told they should be doing this, but they don't necessarily feel how they can do it. They often might have some biases or some discrimination within them that resists working with the biological family, or that still defaults to reliance on the institution. So that's the kind of the heart bit, maybe the gut bit. And then the hands bit is the practical tools. They have the sort of intellectual knowledge that it should be done, but they lack the practical tools for how to do that. So these are the kind of challenges that we're wanting to address now, looking at, uniting all these perspectives, the lived experience perspective, the issue of practical tools to equip the workforce, so that we can overcome some of these factors of resistance, and we can come up with innovative forms of practice that really are game-changing. So it's about positioning the workforce at the center of the reform process. Too often the workforce gets rather overlooked, and people focus on programs and funding those programs and services and the outcomes they want to achieve, without thinking that none of that is possible without a workforce, and none of that is sustainable without a sustained workforce. So often people that we train, they leave the workforce within 1 or 2 years, and then we have to start all over again. So often it's like, how do we have a sustained knowledge and commitment to this process that unites the head and the heart and the hand, so that we have really strong values and practice as well as knowledge in our workforce, how to achieve that in a sustainable way. So I'm going to end my brief comments now by closing this particular slide so that we can just look at the Jamboard. We're going to go to a discussion in small groups in a minute. But I think it would be good just to see, I'm actually going to share screen to the Jamboard just so we can all see what people have been writing on there. But hopefully you've all started to look at that. Just make sure I've got it up on my, okay, I'm just going to make sure I've got it up on my screen too. And then we can sort of read it together. Yeah, it's great to see that some comments are going in here. They're a little bit small to read, but you know, some folks are saying that that care reform needs to look at how we change the role of social service workers who work in institutions, concerned about losing employment. So that's, you know, an interesting one. And please continue to write as I talk. This is really just to bring us all into this discussion together. I've also found that in many countries, there's a fear amongst those, the fear of losing their employment. And ministries responsible for those institutions also fear of losing key assets that they control. There's a vested interest. Sometimes it's a corrupt interest, and you know, orphanage directors or others may be making personal money out of it, or it might just be that it's their livelihood, it's their employees' livelihood, and some of them don't want to lose that. Also, in many cases, they feel like the children that they have in their care have complex needs, and they feel it's a professional task to look for those children, look after those children, and they can't see how the family could do that. But we all know that the family could with the right amount of support. So there is that resistance there. So strengthening the workforce in terms of kinship care, you know, is also an important one that's being mentioned here. That the issue of institutionalization happens because the Child Welfare Committee members are not trained, and that I think there are a number of gatekeeping processes where the people making those key decisions don't really know what family-based care can involve, how it can be achieved and supported, and so they revert to the default, which is the shelters or the institutions. Need to support cross-border collaboration. Families are indeed increasingly internationally mobile, so there's no point having a system reformed in one country if then they go to another country where these things are not in place. Just picking up on anything that looks a bit different from what people are writing here. So we need to have a skilled workforce to provide support to children in placements. We need to grow the numbers and provide training. As I mentioned, Joe has already put a point about children with disabilities often being left behind, and the data shows that often they are indeed left behind. So yeah, there's a wide range of points that are coming, and we'll capture these. We'll make sure they're fully captured. My son is actually now knocking on the front door. I'm going to let him in, which I think might be a good point for me to hand over to Beth to introduce the group exercise, if that's okay, and then we can come back to this discussion in a moment. Thank you. Handing over to you, Beth.
Thanks, Hugh. Hope everything's okay with your son, and he's maybe just coming home from school. Your video's still on, Hugh, in case that matters for you. Please feel free to continue adding some of the things here to the first slide on the Jamboard, things that you see as really the pressing issues, the things that are coming up in your work around the social service workforce. I want to pause just quickly to see if anybody has any issues with the Jamboard itself. Working okay? It doesn't look like everybody has accessed it. So everybody who wants to access it, are you in all right? Okay, silence is golden. Before we go to the next Jamboard slides, I need the presentation slide. So let me see if Alina, can you make it so I can share my screen? Are you back, Hugh?
Yeah, I can share that for you. Yeah, let me do that.
Okay, thanks. I thought you had stepped away.
No,
Great.
I'm still here. Yeah. No.
So that was just meant to get your minds really thinking workforce and thinking about about some of the things that, again, we need to be looking at, be thinking about. And what we would like to do actually is go into small groups. Hugh, I'm not seeing it quite yet, but if we could show the slide. There we go, brainstorming in groups. So we have time. We're going for another 50 minutes here. So we thought that it would be great to get into some conversation in smaller groups and begin really thinking about what some of the content of our brief might be. So we're going to have 3 groups. And because of timing, we're going to have each group look at a different question. There are 3 questions. Don't be too concerned with what those are right this second, because you'll see them with your group leader and on the Jamboard. So the first group is going to be looking at what policymakers should be considered as an audience for our thematic brief, and what key messages do they need to hear. Group 2, what knowledge, skills, or other tools do the social service workforce require to more effectively support and enable family and community services? And group 3, what concrete steps should be taken by government, policy, and decision makers to strengthen the social service workforce? We are going to go, I know it says rotations on the screen, but because our introductions took a little bit more time, we aren't going to rotate. So each group will have probably about 12 minutes to discuss their question, and really we hope to hear from everyone in that small group. We'll use the Jamboard again to note down. There'll be a facilitator for each group, and then we'll come back into plenary and share out a bit some of the key points that we've discussed. And then before we close the meeting, we'll go through some next steps and the timeline. So with that, Alina, would you like to organize us into our 3 groups? And Ani, you will be focusing on question 1, Hugh on question 2, and Beth on question 3. And again, we're using the Jamboard. Hopefully that's working for most everyone. Zoom us out, Alina.
Just 1 second.
Ginny, your last thought was cut off there.
I said you were taking notes.
Oh, okay. Welcome back, everyone. We'll just give a couple seconds for people to come back in, and then Hugh, if I could please ask you to share the Jamboard on your screen. I'm not able to share my screen.
Let me do that for you now. Sorry.
Great. Hopefully
just
we've
pivot
got
to
everybody
the,
back.
Yeah, I'm just going to go to question 1 first.
Exactly. Yeah, great. So welcome back, everyone. I hope that was an opportunity to actually get to know each other a little bit better, but also begin to dig into some of the things that we need to be looking at. And I know we were ambitious in our plans for this meeting, thinking that each of the groups would be able to jump and contribute to each of the questions, but timing didn't work out that way. So we're going to go through them with a bit of a report back from each group. I do want to just welcome you, whether it's now or even after we close the meeting today, to continue to use this Jamboard to jot down thoughts that come to you afterwards. I know I often wake up in the middle of the night with an additional thing that I wanted to say, so do come back to it. Group 1, and I think that is Ani. Would you like to just give us a little bit of a view of what you talked about?
I was only making notes. It was Carolyn who is going to help us summarize. Thank you, Carolyn.
I'll do my best in a minute. So our question's on the screen, so I won't let you know what it is. But we really talked about, in terms of messages that we thought needed to be heard, just re-emphasizing the benefits of family-based care, because countries will be at different stages of the journey, looking at some of the drivers of institutionalization as a way to promote deinstitutionalization and attacking those drivers. Looking at investment in social service workforce as part of care reform, so making sure that social service workers are fully equipped, whether that's around salary or whether that's around basics of phone and transport and that sort of thing. And similarly, looking at skills development of the social service workforce, from professional standards and qualifications to practical training, and linking with paraprofessionals. We talked about investment in families as well as part of that alternative care and care reform. That includes financial and non-financial support for family care, and particularly, having clarity that formalization of a placement isn't a prerequisite for support from the social service workforce. Although we did feel that there was a need for legal, clarity around legal and policy frameworks to appropriately support alternative care. So really having that strength in the legal and policy frameworks. We talked about clarifying institutional mandates of who's in charge of the care reform. And then in terms of the audience, so which policymakers in particular, we talked about high-level policymakers, so Vice President, Cabinet Office was mentioned, as well as focusing on, I don't know if non-traditional sectors is the right word, but making sure we're also targeting finance ministries, for example, that hold the purse strings, looking at local government actors, and making sure there's really cross-sectoral engagement of ministers that could range from environment, sort of climate change push factors, social services, finance, health, education. And then we ended our conversation talking about the need to also engage first ladies, because in a lot of countries, it will be the partners of those who are in charge, often, wives of those who are in charge, who are looking at children's issues, and there's a real need to engage them as well. I hope I captured everything accurately.
Excellent, and very comprehensive. I love that last point about partners of those who are in charge. I think that's really great. So anything burning from either other group members or anyone else? Something burning you really want to see here before we move on to question 2? Okay, over to Hugh and question number 2.
Yeah, sorry, I wasn't very democratic and I didn't appoint a spokesperson, so it's going to be me again, but I'll just try and go through these. At least the text is a bit bigger on this one. So this one is about that knowledge skills of the workforce. And in fact, as was very quickly pointed out, we should have been talking about knowledge, skills, attitudes, and behaviors. And so the first point was around the mindsets and attitudes. So as I said in my intro, often it's knowledge is there, but as another colleague was saying, it's around mindsets, attitudes, it's that human connection. Capacity building should not just be classroom-based, but job on the job, field training. And the workforce need to be equipped to really understand their system. There's a lot of points about them having a systemic approach rather than just taking one case separately at a time. They need to be able to understand root causes and drivers, why the children are ending up in needing alternative care, or why is it that they're so often diverted into institutions, trying to understand root causes and map the system and how the system is or isn't working well together. So a technology supported tool in helping the social work in taking best decisions for children would be important. And obviously technology has a role in also making sure that they document the work that they're doing. And I'm just adding this actually, that handover, often when you have a high turnover of your workforce, someone might have done great work and then the case is inherited by somebody. If it wasn't properly recorded, they don't know what you're doing with the family, so they can't carry on strengthening in the family. The child might end up back in an institution just because there wasn't proper handover. And so engaging with the families and communities at the practice level, that systemic focus I mentioned, really interestingly, self-care. And during COVID, we talked a lot about self-care, mental health and support for the workers themselves, given the stress that they're facing. But you know, the simple point is that an unhappy social worker or a stressed out social worker will not be able to help a child and a family. It will result in stressed out children and families. And so, you know, to do this difficult work, we need to fundamentally support the workforce and equip them to look at things in different ways, and not just one size fits all. It's not just, you know, we put them all into parenting programs, or we give them all livelihood support, or we give them all a stipend, or we give them all one thing or the other thing, but every family is different. And so we need to equip the social service workforce to do that individual assessment at the case level, as well as mapping and understanding the system. And there's a need to decentralize the workforce resources to be more community level, so have an inverted pyramid, so we really drive as much resources to where it's needed most at the community level. And as mentioned there, it all really depends on context and giving the social service workforce capacity to understand and adapt to their context. We can't really prepare a single handbook. A training handbook would never satisfy all needs, so we need to really equip them with the capacity to develop their own skills and practices rather than just, you know, follow the handbook. I think that's a very brief summary. Sorry if I missed anything. If anybody wants to chip in or add to the Jamboard, please continue to do so.
Great, thank you, Hugh. Those seem like some really great points, and I really appreciate how the thoughts about really supporting and taking care of the workforce is important. Anything from the other group members?
Oh, I actually, sorry, there's one thing I missed, which is about climate change. I thought maybe it's being obscured now, but there are things like technology, climate change. You know, there are things impacting on children and families and communities that we all need to understand. If we're doing preventive work, we have to understand the wide range of things that could impact on a community, the resilience of a family that could result in separation. So just, there are more things that social workers need to get to grips with than maybe they were getting to grips with 10 years ago. I think that's the point there. Thank you.
Great. Yeah. Well, if that's not captured there, if you could make sure it gets captured. Anything else? Anything burning? Okay, we could go to the last question, number 3. We were not quite so tidy in our note taking. I'll take responsibility for that. And we also, I tried to be diplomatic, but then we got zoomed out. So I'll go ahead and report back as well. We had the question about kind of concrete steps to strengthen the workforce. And I think that most of these won't be surprising to the rest of the group. A big one was around budget and resourcing. There we also talked about the importance of linking non-government, like donor funds and different groups that are doing things around strengthening the workforce, linking those to government priorities and making sure that government is aware of those. Having the workforce have clear qualifications that are set and that are transparent and that people know about them. formal recognition, really government's taking steps to recognize, in particular, the community-based and paraprofessional workforce, the need for conducive environments, equipment, technology, motivation for the workforce, and also just making sure that the right parts of the workforce have access to the right kinds of equipment and resources that they need. Tackling corruption, there was an interesting point that came out about, sometimes we've got engineers who are assigned as social workers because they're somebody's relative. So really trying to make sure that there are things in place to ensure that the people with the right capacities and right abilities are there and recognized for work with families. Let's see, developing systems of data, and there in particular ways that the government can understand what the NGO workforce looks like, where they're working, have input in terms of their qualifications or accreditation. Again, there was quite a bit we talked about in kind of bringing the non-government and government closer together. Specific case management tools, data systems, et cetera, et cetera. And I think that's most everything we talked about, but let me see if any of the group members want to add anything. We have a couple minutes.
Just briefly, Beth, that we were saying that sometimes there needs to be the case made first for actually having a social
Thank you,
work.
Tessa.
Yeah.
Yeah, that bottom line of making the case for there to be a social service workforce around care. Great, that's an important starting off point. Go ahead, Ginny.
We also talked about the need for developing an alternative care system that focuses on family-based care. At least what I'm seeing is that a lot of social service workforce really has bought into the need for family-based care, but they don't have the resources to place the children into.
Mm-hmm. Great. Great. Well, just before we step ourselves out of this this activity, I just want to open up. Maybe we can actually even stop sharing the screen and see if there are, additional comments on any of those questions, whether that's key messages that that decision makers need to hear, whether that's skills, capacities that the workforce needs to have, or whether it's very concrete mechanisms that governments need to put in place. What have we missed? What's coming to mind?
Well, I don't want to monopolize, but since no one is talking.
You're not. Please go ahead, Ginny.
I just feel that it's important to make an investment business case in both family-based care and in strengthening the workforce around this care reform. I'm not seeing a lot of talk about it, but it truly is an investment case. And I think that national leaders, especially policymakers and the budgeting people, I think they need to really understand the benefits in terms of economics and national development. So.
And it's a good point. Before we hand over to Sandhya, who's got her hand up, I just wanted to echo that, because I remember in Every Child and in Family for Every Child, we were doing cost comparisons and trying to persuade policymakers that, that they achieve much more with the same amount of money if they have children in family-based care, such as, foster care costs, whatever it is, 5 times less, and prevention costs 10 times less than institutional care. But I think often neglected in that argument is actually the social service workforce that you need to invest in. And if you invest in the people who are in the communities, as opposed to the bricks and mortar and the security guards, cooks, cleaners, and all the rest of it that go with an institution, then you're delivering not aid, but empowerment and support to families exactly where they need it. And yeah, we need numbers behind those arguments, but they're the arguments that need to be made. Really good point. Thank you. Sandhya,
Just getting
Yeah,
quite
sorry, Beth,
focused
yeah.
in on just to build on that, on the thematic brief itself, I think those are going to be really important points to draw out as we introduce our policy recommendations, because it really lends a lot of power behind the recommendations. Thank you for that, Jenny and Hugh. Go ahead, Sandhya.
Yep. So what just now you shared, Hugh, that in terms of investment, I think very important piece which we all feel here in Indian context, at least I can share about the reward and recognition doesn't mean only money. And the salary, of course, right time, salary payment or whatever the travel allowances, but a very innovative way of thinking what could be the reward and recognition for the social workforce. So this is a important piece, a policymaker, they should hear about this in a meaningful way. And the second piece, already you did mention about the project and the work for the child participation and the youth, so somewhere the social workforce, their understanding, their mindset and attitude, accepting the youth and care, youth with care experience or children with care experience in a, in a manner where they also understand that they play important role, children and youth, because this is our experience. Sometimes there's a power dynamics always, even we go with this kind of attitude. So think about the conventional way of working a social workforce. So I think that thin line between this power dynamics, it needs to be actually decrystallized. Yeah.
Thank you so much. This is open to everyone around all three questions. We have just another minute or two, or if there are any additions that anyone would like to make, please feel free to unmute. Great start to our collaborative conversations. Yeah, can't see who that is.
Hi, Seema. Yeah. So we have been talking about policymakers and then practitioners. And in India, what I have experienced is there's, another stakeholder, the decision maker. And what we have experienced is this is the most challenging thing to make them understand the importance of family-based alternative care, because they are the decision makers and their stake is very important. Their stand is very important. So when we are talking about strengthening the workforce, we should consider the decision makers as well. And strengthening and building their capacities.
Great point. So just considering all those levels of the workforce, not only professional social workers, somebody mentioned earlier, community-based paraprofessionals, but here you're talking also about the really higher level policy and decision makers as a part of the workforce.
Yeah, because in India, the social workers and practitioners, they are there to take, the action. But the decision is taken by another level of, another carer. So it's important to engage them as well.
Great. Important point. Thank you so much. I'm going to go to Chipo for a last comment, and then back to Hugh and to Ani to talk about our next steps.
My quick question was, or thought was just about how we're going to engage children as stakeholders as well in this. I don't have any thoughts exactly as to what, but I think it's something that we should already, when we're talking about stakeholders, children have to be key stakeholders. So how are we as a group going to make sure that whatever brief we come up with, anything we do is going to also reflect whether children's voices or a reflection of what children, whether that's through lived experiences, anything, but we just need to consider how we're going to do that.
Excellent point. I couldn't agree with you more, and I'm so glad you're bringing that out. Just to follow on that, just as one possibility, we can certainly connect with the other task forces. There are two that I have in mind specifically. There is a parent advocacy group of parents and caregivers, and then there is a care leaver advocacy group as well. not children, but it's a great point. So thank you for that. I've noted it down. Hugh, do you want to talk just briefly about the next steps before Ani closes us out for today? We have about just over 10 minutes.
Yeah, I just want to take 1 minute to say that actually when the point was made about, I think Seema was making a point about decision makers. Actually, I think she meant community level decision makers. It's actually in India, you have the child welfare committees. You know, these are gatekeeping bodies at the most local level that although you might have a professional in some sense of the word who is tasked with supporting the family, but actually the decision on where the child goes is taken by a committee. If those committee members, and in ex-Soviet countries, they're sometimes called commissions of minors or commissions of minors affairs, if those committees just all defer to institutions and shelters because that's all that they know, even if the social service workforce is equipped, then the local decision makers still direct the children to the institution. So I think that's one of the issues. And also I wanted to echo what Chipo was saying, just to say that one innovation in practice that I've noticed actually in the UK in the last 20 years is that when there used to be a them and us, with on one side of the fence were the social workers, on the other side of the fence were all the clients or the beneficiaries. It's now breaking down, and you actually have teams that composed of social workers, but also of youth advocates, of young people with lived experience, acting as advisors, not just on policy, but on cases. And then you have parent advocates and you have family members, again, acting as advisors, and sometimes even consultants on cases when they have lived experience and they've worked through that lived experience, they can help others. So really that uniting of forces, so it's no longer that them and us divide between, you know, we're the professionals and you are the guys with problems. It's actually a much more, we all can draw upon our different experiences, and more people can go into the workforce motivated by their lived experience. Not all, but many who go into the workforce actually want to try and right the wrongs that they experienced when they were a child. So that also needs to be recognized. But that's more than enough from me. I'll just bring up the slide on next steps, if that's okay. Thank you for this fascinating discussion, and I just wish we could have continued, but you know, time is pressing. The introductions were fabulous because it was so important to get to know us all. My computer's doing funny things. Okay, here we go. So the first opportunity to do even more, if you want to really get roll up your sleeves, you can join our drafting committee. So this is going to be, we're thinking around 5, 6 or so people who are willing to get into the writing of the drafts. You know, obviously, you know, with Beth's support, we're going to be making a first stab at that, but we would like some active reviewers. At some point, the whole task force will have a chance to review the draft before it's finalized, but actually to take us through different stages, it would be good to have a drafting committee who will meet more regularly than the task force itself, and will also be exchanging drafts with each other. So any volunteers for that, please, by November the 30th, you can write to myself and Beth and Alina, any one of us, but we'll make sure that that goes into a combined list. Review the draft outline. So we're going to work on a draft outline so that then you can all see that by the end of December to see, does that outline cover the main areas? We'll probably never be able to cover everything, particularly because this is a relatively short thematic brief. We know that policymakers tend not to read anything that's too lengthy. So we want to keep not just the overall length down, but we want to keep the points quite concise, but also saying something a bit new so that they can sit up and pay attention. So we're going to have to be a bit editorial about the outline, not putting everything in. We don't want it to be encyclopedic because then I think it will be off-putting. But just as a heads up that by the end of December, we want to have a chance for people to review that outline so we can all be agreed that that's the kind of outline that we want to use to develop the thematic brief. And then we very much encourage all of you and your partners and your colleagues to help us submitting short case studies and country examples of all of the things that you've been talking about in the sticky notes. So just if you could just send us more written up case studies, they don't need to be long, just 1 or 2 pages, but just so that we can then feature those in the thematic brief, or maybe have a compendium that the thematic brief can link to, because we may not be able to feature all of them in the thematic brief, but it would be great if the thematic brief could then link to a sort of resource base and people can explore different examples in more detail. We know that Better Care Network does that brilliantly already, but I think many of our policymakers don't have the time to go into a very detailed website such as the Better Care Network. So we're really just the ones that we want to give prominence as illustrating the points we're making in the thematic brief. And then by all means, continue to invite others to contribute. So this was a big group, but it doesn't need to be capped at this number. So if you feel that there's key people that you want to join, either physically attending future task force meetings or helping, look at the draft, look at the outline, or particularly in sharing examples, then please do that. We'd love to continue to hear from people. The next meeting is scheduled for December the 15th, probably roughly this time. Sorry for those of you in East Asia that this is very late. I think some of you dropped off already, and even those in South Asia, it's pretty late for you as well. So we might go an hour earlier, but we'll have to see who's signing up. And if we do end up with more of a Western Hemisphere and Eastern Hemisphere groups at different times, we can do that as well to accommodate people's different time zones, as well as accommodating different languages as well. So, but the next meeting, at least if you just keep that date in your diaries, December 15th, and we'll send more details. And hopefully by then we'll have solved all the glitches around accessing the link and getting everybody registered, just to really steer you towards the Transforming Children's Care platform and the group space, because we want to use that group space as much as possible for updates. And you can also message each other. You can put a comment on there. We'd rather do that than do it all through email, because we know that emails have a lot of limitations. So we'll try and do as much as we can in the platform, but we have to get everybody in the platform, and some of you have had technical problems with that. So we're trying to overcome those as well. Okay, I think that's everything. Beth, anything I've missed before we hand over to Annie?
No, that's great. I see Sandhya already with a question of an outline for case study. We are going to post a Google document. When case study is probably not quite the right word, these need to be very short. If you think about sort of a text box, maximum 1 paragraph, this is what, this is what this policy recommendation or this action looks like on the ground. But we'll post a Google document with some guidance around that and a place for you to post them. Thank you for that great question. That's forthcoming. I think that's all from me. Yeah, lots more to come. This is great. Great turnout, great engagement. Thank you for staying with us for a whole 2 hours. And over to you, Ani.
Indeed. Thanks, Beth. And I also won't take more than a minute. Just really want to thank everyone extremely sincerely for taking the time, 2 hours, to participate with us. And of course, those who were not able to make it for both the hours, I hope you're watching this recording, and we would like to also thank you for that. And we want you to continue to join us in our subsequent meetings. Next is on the 15th of December, and participate and contribute to the drafting process as well. Just wanted to emphasize, and I think that has come out quite clearly, but the thematic brief is really the end of the process. I think for us, the process is as important in terms of having us coming together, discussing critical issues relating to the relationships between care reform and the social service workforce. So it's really a wonderful start of that process of continuing this dialogue on the role of social service workforce in care reform. And it's all thanks to all of you and your experience and your expertise. And we continue to look forward to receiving those inputs and your learnings from your experience. So thank you very much. Last but not the least, thank you, Alina, for helping us put together this whole webinar, the session, the meeting. Thanks a lot. And also for very seamless transition into groups and back from the groups into the main groups. Thank you so much. And before we end, thank you, Beth, for helping us coordinate the entire process. Beth was the one who designed today's meeting, designed the PowerPoint presentation. So thank you so much, Beth. And thank you, one and everyone. We look forward to continue working with you this year and the next year. Thanks a lot. Bye-bye.
Bye.
Thanks, everyone. Goodbye. Have a great day.
Thank you.
Hi, Alina. You can stop the recording now, probably.